We've previously talked about several components of the Mommy Makeover. I'd like to expand upon another one of those at this time. So we're going to go in more depth. So if that's what you're interested in, stick around with us on this. The next part would be what we do for tummy changes or abdominal changes. Tummy would be the lay term that we use for this, or tummy tuck. What we do for a post-pregnancy tummy, say after 2 or 3 pregnancies that have been stretched and shrunk and stretched and shrunk, is going to depend on the condition of your skin for the most part. If it's just fatty tissue, we can do lipoplasty of many different varieties that will get rid of the extra fat. But the wild card here is, what is your skin going to do? And for most ladies who've had 2 or 3 pregnancies, it's not going to probably shrink back into the condition that you want. Some ladies also have a cesarean scar or a hysterectomy scar, some other kind of scar that's complicating adequate shrinkage of that tissue. So if those scars are there, then we'll incorporate those in a tummy tuck scar, which is across the lower part of the tummy, right in the crease, right above the hairline, extending out to the hip. People say, how far does it have to go? Well, it's just dependent on the geometry of what we're trying to do for you and your tummy, but usually just out to the point of the hip. We then lift that skin and fatty tissue off the surface of your muscle. It'll give us a chance to look at those vertical muscles called the rectus abdominis and see how those have weathered your pregnancies. They typically push to the side, and after a couple of times, sometimes they stay too wide. So no matter what you do to make the muscles more fit and more toned, they're going to be pushing from this direction instead of from this direction. So what we'll do is we'll give you a little internal corset from the xiphoid down to the pubis, and just take a little stitch that just pulls the edge of the muscle back to midline. We don't cut your muscle, we don't go on the inside of your tummy at all. It's all right there on the lining. But that is really an important part of rejuvenating and restoring your tummy, and that is to check those muscles. So when we do a tummy tuck, it's part of the procedure. We don't charge extra for it. It's not considered additional. It's just considered part of a complete addressing of your issues there. So then we see how much skin and fatty tissue is redundant, and we just stretch it down like taking the wrinkles out of the quilt on your bed. That's the first thing you do with the wrinkles. You just kind of lift the covers up and stretch it out and let it redrape. That's what we do. Take the extra off. The result is a scar right there on the lower part of your tummy, and I haven't met a patient yet that didn't say it wasn't worth it. Probably the biggest recovery that we do in the things that we do are related to tummy tucks. You say, why? Well, it's because it's your core. Everything you do involves your core. We're taught about that in fitness these days, and no difference here with this. So get up out of a chair, cough, deep breathe, go to the bathroom. You're going to feel it pull here for about 6 or 7 days. But for ladies, and most of the people we do are very active females who look at me and go, no big deal, I had a hysterectomy or something like that. And it's nothing like those kinds of things, but there is a soreness here for about a week. You do wear a compression garment. We have you wear that for about a month. You take it off to shower, take it off to wash it, but you wear it. It helps give your skin a more smooth appearance, helps your swelling go down faster. One thing that we'll often add to this is something that is included in what's called this circumabdominal approach to rejuvenation of this part of the body. For years we did tummy tucks, and ladies would come in and they'd go, I love it, but why didn't you say anything to me about my lower back? Well, it's because they came in and wanted to talk about their tummy. Now we've learned that you really can't talk to someone adequately about this rejuvenation of this area unless you talk to them about the lower back. Oftentimes there's a thickness above the belt line back here that comes with that post-pregnancy change. So in people who choose to do this, we'll do some lipoplasty of the lower back, and gives that curve and that smoothness, and really it's a hit when you address the front and the back at the same time. They all are covered by your compression garment. You heal at the same time. It's a very common combination to do. Recovery that we've talked about before, 1 week of no vigorous activity, no heavy lifting, no straining for a week, but you're showering the next day, you're walking that night, you're driving as soon as you're not taking narcotics for pain, which is usually a day or 2. 90% healing in 3 weeks, 80% of your swelling's gone in 2 weeks. Takes about 6 weeks before you say, I kind of forgot that I ever did this. So if you'd like more information as to whether you are a good candidate for tummy tucking, give us a call at 205-408-9787, 9787. Set up your own personal consultation, or go see what we're all about on our website, ClintonPlasticSurgery.com.